Hi, I'm Ajay Swaminathan. I'm a consultant gynecologist. I have a special interest in keyhole surgeries or laparoscopic surgeries and laparoscopic hysterectomies. So it's a very short video on hysterectomy. So what is a hysterectomy? Hysterectomy is an operation to remove the uterus or the womb. It is a major operation. In the majority of the times, we would be removing the fallopian tubes at the same time as the uterus. With regards to the ovary or ovaries, we either conserve them or we remove them at the time of the said hysterectomy. So what are the different kinds of hysterectomies? Most of the hysterectomies I tend to perform are laparoscopic or keyhole hysterectomies. Small cuts, usually between 0.5 centimeter to 1 centimeter, are made in the abdomen or the tummy, and the uterus or the womb is removed through the vagina. Sometimes we do what is called an abdominal hysterectomy, which involves a bigger cut. That cut could either be a bikini line cut or an up and down cut. Vaginal hysterectomy is when the womb is removed through the vagina. There is no scar in the tummy. A total hysterectomy is when the body of the uterus or the upper part of the uterus, along with the cervix or the neck of the uterus, is removed. In a subtotal hysterectomy, the cervix is left behind and we remove only the body of the uterus. Now, why do we do a hysterectomy, or what are the reasons for performing a hysterectomy? And the usual ones, the common ones are heavy, painful or abnormal periods. So it is done in this case usually when it has not improved with other measures, or when hysterectomy is probably the only option left. Fibroids of the uterus, which can either cause heavy painful periods or pressure symptoms, for endometriosis, for adenomyosis, also for cancers. The usual cancer we tend to deal with by doing a hysterectomy is cancer of the lining of the uterus. Sometimes we do it for precancerous changes, usually for precancerous changes on the cervix. It can also be done as part of the treatment for premenstrual syndrome. Now, is hysterectomy to be taken lightly? The key thing is no. Why? Most of the hysterectomies are fairly straightforward. Women come in, have the procedure, go home the next day. Sometimes serious complications can happen, and they include complications from anesthetics, risk of bleeding, damage to internal organs like your bladder, bowel, blood vessels, or ureters. So a very detailed discussion regarding a hysterectomy, the feasibility of it, and the complications have to be dealt with at the time when you see your gynecologist and when you are consented for the procedure. Now, the other usual question I get asked is, how long do I stay in the hospital? Almost all the hospitals I've worked have an enhanced recovery program. The enhanced recovery program aims to get you back to full health as quickly as possible after a planned hysterectomy. So usually you are admitted on the day of the operation. You go home, usually after an overnight stay. For an abdominal hysterectomy, the stay is usually longer. You might have a catheter which drains the urine. I tend to remove it usually at the end of the hysterectomy while you're still under the anesthetic. Sometimes we keep it while you are staying for the overnight stay. Recovery after hysterectomy is fairly detailed, and that's a very different video. But during the stay in the hospital, we are encouraged to mobilize. And when you go home, you need to rest and avoid lifting heavy weights or heavy objects. And also you should build yourself up gradually. A very common question I get asked is, what is surgical menopause? Okay, if during a hysterectomy the ovaries are removed, you will go through the menopause immediately. If the ovaries are left behind, or if the ovaries are conserved, then the menopausal symptoms might be experienced a bit earlier than your natural age of menopause. But both these can be treated with hormone replacement therapy. As I mentioned before, the recovery after hysterectomy, I have a different video And if you have any questions, I'm more than happy to answer them for you. Thank you very much.